Tim Curry's autobiography, Vagabond, was just released, marking 50 years since the Rocky Horror Picture Show first hit theaters. I still remember going to a midnight showing of Rocky Horror one Saturday night in Berkeley. People came in costumes and danced in the aisles. Unforgettable. I had never seen anything like it. I didn't really follow Curry's career, but when I read about his stroke, his story grabbed me. So I did some digging. What you're about to hear is Tim Curry's stroke story, told by Google Notebook LM's dynamic duo of AI. In an upcoming episode, I'll share my own stroke story.
Welcome to the Deep Dive. Today we're looking at, well, a real icon, Tim Curry. Dr. Frankenfurter from Rocky Horror, or maybe the original Pennywise from it. Just these huge, unforgettable roles.
Absolutely larger than life.
And now he's written this memoir, Vagabond. And it gets really candid about a huge turning point in his life.
That's right. So our mission today, our deep dive, is really getting into the sources around the major stroke he had back in 2012.
Yeah.
We want to look at how it actually happened, his reaction, the medical side of it, and importantly, what he himself thinks might have, contributed.
And how it just completely changed everything for him. It's quite a story, especially how it started. Not like during some high-stress moment, but somewhere totally ordinary.
Yeah, it really shows how vulnerable anyone can be, how quickly things can change.
Okay, let's unpack this. Because where it happened is, well, it's kind of stunning.
It really is. So picture this, July 2012, Curry's around 67. He's not on set, not on stage.
No, he's just getting a massage, a professional massage.
Right. And this part is key because it really speaks to how sneaky strokes can be sometimes. Curry said later he had no idea, like zero clue.
He wasn't in pain, didn't feel weird.
Nope. He remembered feeling, quote, fine, just totally unaware that this, catastrophic event was happening inside his brain at that very moment.
Wow. So obviously he wasn't the one to raise the alarm.
Exactly. It was the masseur. They noticed something was off, probably, facial drooping, or maybe he couldn't move one side properly, something alarming.
And when the masseur suggested calling an ambulance,
Curry's reaction was just complete denial. Pure, this isn't happening.
he actually said something, didn't he?
He did. He admitted you just waved it off, told the masseur, that's so silly.
That's so silly. Well, having a stroke, I mean.
Yeah. It's hard to fathom. Your life's potentially on the line and you're dismissing the help.
Which just highlights, doesn't it, why acting fast is so vital with strokes? That masseur ignoring Curry's protests and making that call.
That was the life-saving decision. Absolutely. Without that quick action, the outcome could have been much, much worse.
Because time is brain, as they say.
Precisely. Every second counts in terms of potential recovery and saving brain function. Okay, so he gets rushed to the hospital, diagnosis, major stroke. And because they found blood clots, it was likely a severe ischemic stroke, meaning blocked blood flow.
Blood supply cut off to a part of the brain.
And the treatment back then in 2012, it had to be really aggressive.
Very invasive, yeah.
You mentioned emergency brain surgery, a craniectomy. Can you break that down for us? What exactly is that?
Sure. A craniectomy is serious business. It means essentially removing a piece of the skull bone.
Wow.
Why? To relieve pressure. When you have a major stroke like that, the brain tissue that's starved of oxygen starts to swell up. And inside the skull, there's no room for swelling.
So the pressure builds up dangerously.
Exactly. It can crush the brain, causing more damage or even death. So removing a piece of the skull allows the brain to swell outwards, relieving that fatal pressure.
And in Curry's case, they did this to relieve pressure and remove clots?
That's right. The sources say they removed at least 2 large clots. Now, we don't know if he got the clot-busting drug, TPA. First, that's usually given intravenously within a few hours.
Right.
But the fact that he needed open brain surgery tells you the blockage was really significant and the brain swelling was an immediate life-threatening problem.
And the immediate results were, well, stark. Paralysis on his left side. He said his face kind of went sideways.
Devastated.
And the struggle with speech, that seems central to his emotional recovery.
Absolutely. I mean, think about it. His voice is legendary. It's such a core part of his persona, his career. And suddenly, he had severe speech impairment. He needed intense rehab just to relearn how to speak. He said very plainly he hated not being able to speak. You could only imagine how profound that loss felt. Wow. Okay. So he gets through this incredibly intense surgery. The immediate danger is maybe past.
Mm-hmm.
Where does his head go then when he starts to process what actually happened?
It's quite moving, actually. He said his mind went straight back to his childhood, to his father.
His father?
Yeah. His dad was a Royal Navy chaplain, and he'd also had a stroke when Tim was only, I think, 11 years old. His father was young, too, just 49, and sadly, he died not long after.
Oh, wow. So that same event echoing down through the family, that must have been terrifying.
Absolutely terrifying. He admitted he was scared, but then, interestingly, he also thought about how his father handled it back then.
How so?
Well, what's fascinating here is that he remembered his dad being really determined to not be a changed man, especially for his kids.
Huh. Like a refusal to be defined by it.
Exactly. And it seems like that memory, that kind of family legacy of not giving into illness became a sort of psychological anchor for Curry himself as he faced his own recovery.
Okay, that makes sense.
Yeah.
So let's shift gears a bit. Let's talk about the why. People always want to know, what are the risk factors? Did his lifestyle play a part? And Curry, in his book, is apparently incredibly honest about this.
Oh, he really doesn't hold back.
Yeah.
Especially on smoking.
Yeah.
He lays it out there plain as day. He says, the day before I had the stroke, I smoked 3 packs of Marlboro Reds.
3 packs in one day.
3 packs. And then he adds this like darkly funny line, I won't be doing that again.
Well, no kidding. But still, 3 packs.
Yeah.
The strain that puts on your whole system, your heart, your blood vessels, it's huge.
Astronomical.
Yeah.
A massive risk factor for clots and vascular problems. But, this wasn't actually the first time he'd kind of been warned that his intensity was maybe taking a toll.
Really? What happened?
Well, years before, back when he was filming Clue, remember him as Wadsworth the butler? All that frantic energy?
Oh, yeah. Brilliant physical comedy.
Totally. Well, apparently, a nurse on that set took his blood pressure one day and basically told him straight up, you're pushing so hard in this role, you're at risk of having a heart attack.
Just from the physical exertion of the performance.
No, yeah. So that incredible energy that made those characters like Wadsworth or Frankenfurter so captivating, it was literally pushing his body towards a danger zone, even way back then.
Wow. The performance itself was a risk factor.
Kind of seems like it, yeah. His art was demanding a hell of a price physically, and the memoir touches on other pressures too.
Like what?
He talks about living in New York in the 80s and confirms he was using cocaine most evenings back then.
Okay.
Now, he qualifies it, says he still had work to do during the day, insists he wasn't Mr. Snortorama, but it paints a picture of a pretty high-octane, high-pressure lifestyle.
And alcohol, is that ever an issue?
He does mention that later on, alcohol became more of a crutch. He actually went to rehab for it, though he says he didn't feel he quite qualified as an alcoholic. So it's complex, intense work, substances, it all adds up.
And there was something else they found after the stroke, wasn't there? Another health issue.
Yeah, a really serious one. Doctors discovered he also has an aneurysm in his abdomen.
Good grief.
It just reminds you, doesn't it? These major health events, they're often not just one thing. It's usually multiple factors sort of building up over time. The stroke was devastating, but it was part of a bigger picture for his health.
Right. Okay, so let's talk about now. It's been over a decade. What's the lasting impact? We know he's still working, doing voiceovers, appearances, but what's the day-to-day reality?
Well, the most visible thing is mobility. He uses a wheelchair. The stroke primarily affected his left side, causing pretty significant paralysis.
Oh, he still can't walk.
No, he can't. And he's quipped about it, saying it's very restrictive and means he won't be singing or dancing anytime soon. A bit of that dark humor again.
Yeah. And the paralysis affected more than just his legs.
Oh, yeah. His face, too, he described it as going sideways, and his left arm is unusable.
But didn't he give his arm a nickname?
He did. This is classic Curry humor. He calls his non-functioning left arm Teddy.
Teddy. Oh, my gosh.
I know, right? To find that bit of humor in something so profound, it's kind of amazing. And it seems like that attitude, that resilience kicked in pretty quickly after the immediate crisis pass.
It sounds like it. But it wasn't just physical, right? There were cognitive challenges too, speech.
Huge challenges there initially. He actually couldn't speak at all for several weeks.
Wow, weeks. For someone whose voice is so iconic.
Exactly. He needed a lot of therapy, physical and speech, just to adapt and relearn how to speak. He said he absolutely hated not being able to speak.
I can only imagine.
Yeah.
And memory. For an actor, that's crucial.
And that seems to be the toughest lingering issue. He's brutally honest about it, says he has severe problems with short-term memory, putting it bluntly. I can't remember a thing. And he basically said that's the main reason he feels he could never go back to doing live theater again. The memory demands are just too high, which for someone of his stage background is just heartbreaking.
Absolutely devastating. Okay, but here's where it gets really interesting, I think. Despite all this, the physical limitations, the memory issues, the vulnerability, the whole narrative seems to pivot to this incredible mental strength.
Yes. He talks a lot about humor being key, but also this active rejection of self-pity. He actually credits his mother for that.
His mother.
How so? Apparently, her philosophy was pretty sharp, almost tough love. She used to say something like, "Why are you so important that we have to pity you?"
Whoa. That's blunt.
Incredibly blunt. But he seems to have really internalized that. He uses it like as a shield against feeling sorry for himself, even when he's had to relearn the most basic things.
That refusal to be pitied.
Yeah.
It explains a lot about why he keeps going, doesn't it? Even though he's admitted he's scared of having another stroke.
Definitely. He said, I wouldn't want to go through it again. It just makes you so vulnerable. He acknowledges the fear, the vulnerability.
But he still works. Voice acting. He did that cameo as the criminologist in the TV Rocky Horror.
Right. And he goes to conventions, meets fans. He keeps engaging. His whole attitude seems summed up when he says, "I've had the opportunities and I'm still showing up."
I'm still showing up.
Yeah.
That says it all, really.
It's this powerful statement of just refusing to disappear, refusing to be defined solely by the stroke, despite the massive physical changes.
He's found a new way, redefined what his career looks like. It's really a testament to that resilience we talked about.
It really is. But it does make you wonder, given those lasting effects from the 2012 stroke, if the exact same type of stroke, ischemic clot-based, happened today in 2025.
Yeah. Would the treatment and maybe the outcome be different?
Exactly. Would his odds be better?
That's probably the most important question to ask here, and the answer is almost certainly yes.
Really?
Definitely. The advances in neurointervention just in the last, say, 10 to 12 years have been, revolutionary isn't too strong a word. Remember, back in 2012, they did that craniectomy, open brain surgery.
Right, to remove the clots and relieve pressure.
Today, for that kind of large vessel blockage, the standard of care would likely be mechanical thrombectomy.
Okay, what's that? Sounds less invasive.
Much less invasive. Instead of opening the skull, surgeons make a tiny incision, usually in the groin or sometimes the wrist. They insert a very thin tube, a catheter.
Okay.
And they thread that catheter all the way up through the arteries, guided by imaging, directly to the clot in the brain.
Wow. Right to the source.
Precisely. Then, using incredibly small tools on the end of that catheter, think tiny vacuums or little wire cages called stent retrievers. They physically grab or suck out the clot.
So they pull the blockage out from the inside.
Exactly. Pull it right out. Compare that to removing a piece of skull back in 2012. It's a world of difference. We're even seeing things like the millispinner thrombectomy now. Devices that spin super fast to break up and suction the clot even quicker.
And faster clot removal means?
Less brain damage. The faster you restore blood flow, the less brain tissue dies. That translates directly to potentially better outcomes, less paralysis, less speech impairment, maybe a reduced need for the kind of intensive long-term rehab Tim Curry went through.
That pace of change is just stunning. But like you said earlier, and like Curry's own story shows so clearly, all the best technology is useless if the patient doesn't get to the hospital fast enough.
Or if the people around them don't recognize what's happening.
Right. That phrase, time lost is brain lost. It's chillingly accurate.
It is. And this is the key takeaway for everyone listening. Tim Curry's experience is the perfect illustration. The victim might not realize it themselves. That's why we all need to know the warning signs. We need to know fast.
Okay, let's break down that acronym, FAST. Remind us what each letter stands for.
Absolutely. F is for face. Look at their face. Ask them to smile. Does one side droop? Is the smile uneven, lopsided?
Okay, face drooping. What's A?
A is for arms. Ask the person to raise both arms straight out in front of them. Does one arm drift downwards? Can they not lift one arm as high as the other?
No.
That signals weakness on one side.
Face, arms.
S is for speech. Is their speech slurred? Are they struggling to find words? Do they sound confused, maybe like they're intoxicated when they haven't been drinking? Any difficulty speaking or understanding?
Face, arms, speech, and T.
T is crucial. It stands for time. Time to call 911 or your local emergency number immediately. If you see any of those signs, F, A, or S, even if it seems mild, don't wait. Call for help right away.
Time is critical.
Beyond critical. And here's something really important based on modern understanding. Even if the symptoms appear and then disappear quickly, what people sometimes call a mini stroke or TIA.
A transient ischemic attack.
Right. Even if they seem to resolve, you still need to call 911 and go to the emergency room immediately.
Yeah.
Don't think, oh, it passed, I'm fine.
Why not?
Because a TIA is often a major warning sign that a full devastating stroke could be imminent. And crucially, those time windows for the best treatments, like that thrombectomy we discussed, are very short, often just a few hours from when symptoms first start.
So no waiting, no driving to urgent care, straight to the hospital emergency department.
Absolutely.
Yep.
Straight to the hospital. Getting there fast is the single best thing you can do to minimize disability or even save a life.
What an incredible story. From the shock of the event through that resilience and contrasting it with how medicine has leaped forward.
Mm-hmm.
It really leaves us with two big takeaways, doesn't it? First, just Tim Curry's amazing spirit, that determination to keep showing up.
Yeah, truly remarkable resilience.
And second, the absolute critical importance of someone else noticing, of external vigilance.
He didn't save himself in that moment. The masseur did.
It really makes you think, doesn't it? The sheer luck involved there. It wasn't family, wasn't a doctor nearby. It was an attendant during a routine session who saw the signs and acted against the patient's own perception.
It speaks volumes about how vital it is for everyone to be aware for basic training like that masseur likely had.
Yeah.
Because you never know when you might be the person who needs to recognize the signs in someone else.
Wow, what an incredible story. It's easy to say, don't smoke 3 packs a day, and of course that's true. But the deeper takeaway is harder. Sometimes you have to act, call 911, get someone to the hospital, even when they tell you they're okay. That moment of courage can save a life. Thank you for joining us, and please follow our podcast and join us again. This is Elton Sherwin. Stay safe and stay healthy.